Ashley. So thanks for coming into supervision today. So what would you like to accomplish out of this supervision session today? We've met a couple times before, but this one I want to just focus on what you want and what you think would be most helpful to get out of it.
I guess I'm having trouble with one of my clients.
Okay.
We can call her Amanda.
Okay.
She came into the hospital and she was coming off of a lot of different drugs. And so this is the first time that she's really been clean.
Mm-hmm.
And she's having a lot of trouble dealing with, I guess, all the past repercussions that have happened from her drug use.
Oh, okay.
And so, like, now that she's kind of forced to face reality, since she's been sober for a couple weeks now, kind of dealing with some legal stuff, just a bunch of different stuff, and I'm kind of just stuck on where to go with her.
Where to go at all?
Yeah, she's really open. We have a pretty good relationship.
Good. So you established rapport with her.
Yeah, we have a good relationship. We've been meeting a couple times a week,
Okay.
and she's been coming to all my groups and stuff like that. But I guess I'm just kind of, it seems like we're almost backpedaling every time we meet, because when we talk, it's like just kind of the same stuff over and over again. I want to make sure that she gets the most out of our sessions.
Okay.
And so I'm just kind of stuck.
So, is your supervision question, I'm just going to say, would it be, where should I go? Not necessarily where should I go, but what happens when I'm stuck, and what should be the purpose of this relationship?
Yeah.
So it's kind of like you establish rapport with her, and you're also kind of figuring out how can you be most helpful with what she's going through right now, because it sounds like a lot of grief, maybe with relationships that could have been possibly lost.
That's a very good point.
Trauma,
Mm-hmm.
with experiences that she had while under the influence of those drugs.
Yeah.
And now just coming to the realization of like who she is, and like a lot of self-exploration.
Yeah.
Who am I without drugs? So I understand that you would definitely have some difficulty, but there's a lot of different routes to go with this.
Yeah.
With this client, sounds like.
Yeah.
Okay, so what I think would be good here is, because do you feel a lot of personal like struggle with this, like just not knowing where to go? Do you feel like it's more of like, it doesn't sound like you lack the counseling skills to go forward with this. It's just more of like a personal confusion of like, well, this could be helpful, this could be helpful. Is that?
I think that's kind of where I'm at. Like how you said, there's a lot of grief, there's a lot of trauma. She's had a pretty traumatic past.
Yeah.
And just like kind of the realization of who am I without drugs. And that's kind of the angle I've been on, but I think it might benefit maybe to go back towards the trauma and the grief and stuff and process that. So yeah, that's kind of where I'm at, where to personally go with it.
Okay. So I think that a person-centered supervision model would be really good for this right here, because like I said, I'm going to focus on you and your personal feelings about it and what you want out of this relationship with her. So you told me a little bit about the client, and I just want to know, tell me what kind of relationship you wish to build with this girl. Not necessarily specific goals, because that's obviously your question, but tell me ideally what kind of relationship you hope to have with this client.
I think my hope with her is just kind of show her that like the therapeutic process and therapy is helpful, because this is the first time she's ever been in an experience with therapy and like with medication management and stuff like that you get in the hospital.
So very intense.
Yeah, so kind of just to show her that if you could continue, since I'm kind of just a stepping stone, like I'll provide that first part of her foundation into her recovery process.
Yeah.
But obviously outpatient therapy and other things will be important in her process. So kind of just maybe building that relationship where she does feel comfortable going to see someone else on an outpatient basis.
So developing that relationship for future.
Yeah.
Okay. And I think that sounds a lot like, like you're just helping her develop those skills for it, and that she has a safe, comfortable environment to express what her experience is, or whatever would be most helpful for her to express.
Yeah.
So at this point, how well would you say that you understand this client?
I think I understand her pretty well. There's some more stuff that's still
iffy.
Yeah, a little bit of her story is kind of hazy, just because she's kind of starting to remember a lot more.
Yeah.
And so as she remembers more, then I learn more, which makes the dynamic change a little bit. But I would say that I'm on a pretty good level with her, and I feel like she thinks I understand her pretty well.
Okay, so it's not like a power dynamic or anything. She feels like pretty much an equal.
Yeah.
Which is great for fostering that safe environment that we just talked about.
Yeah.
So when you are in session with her, tell me about what it's like for you and while you're in session with her. Because that's a lot of stuff to take on: grief, trauma, addiction, a lot of different subject areas that you're going towards. So like, what was it like for you during? We can either go on the last session or something that you recall.
Okay.
Just tell me a little bit about that experience for you.
It was good. It was a good session. We had pretty good rapport, and that's really the first time that she kind of opened up about a lot of her past issues that she was having, and that she was kind of struggling internally with herself about. So I'd say it was a pretty good session in the terms of we broke some stride, and she felt more comfortable confiding in me. But in the middle of the session, I kind of felt like, am I even doing anything therapeutic? Not really sure how to go with this. And then at the end, when we kind of closed, and I told her that we would meet in a couple of days to kind of go over some more stuff, get some more information about the past relationships, stuff like that, she said that it was really helpful, but I didn't really know what was helpful about it.
So you didn't feel personally that you accomplished much?
Yeah.
Okay, so what I'm going to say to you is I think you've been doing a great job, and I think that you should trust your instincts. Trust the knowledge that you've gained from your program and from your experiences with other clients, because that trust is going to gain confidence within yourself, which will help you find which way do I think is, because it's your judgment, which way do I think is going to be most helpful to go with this client. So just trusting your instincts, because it sounds like you might be doubting yourself, because remember, rapport is one of the most basic skills. Rapport building is a basic skill to use in counseling.
Yeah.
And a lot of the time, I think that people don't count that as counseling because we're not doing anything we think monumental or life-changing. But that is the first step. Like you said, you're a stepping stone. This is the first step of, one, fostering that safe environment, creating that for her. And I think knowing that can help you understand that, like, you are doing more than you know.
Yeah.
You have all the skills. That's exactly what this model is based on. This model is based on the belief that we all have the skills that we need for our personal and professional lives. And as long as you continue to, work for it and obtain your skills, like, you can use them. So I want you to be confident in your skills of what you have.
Yeah, that makes a lot of sense.
So, yeah, so what are your goals? So you want to create a safe environment for her, and what are your feelings? Are you having any personal reactions to this? What is I know you told me a little bit about what it was like in the session and counseling wise, what it was like for you, but personally, tell me about how it felt for you and things that your personal reactions that may possibly have come up, because it's a lot of different things.
Yeah, I think she's a really likable person, and so I'm more drawn to her, and she's more open than some of my clients, so it's easier for me to kind of build that therapeutic relationship with her. But I do see some personal reactions, like, just my heart breaks, like, when she tells me these horrible stories about things that have happened. She's raising her son on her own and trying to get clean for him, and just different things like that. She recently found out that she was STD positive for a couple of different STDs, so we've been working on that. She just found that out in the hospital. So it is kind of more on a personal level, like, it just is a tough thing to hear.
Yeah, it sounds like she's been through a lot, and that spiral that you fall down when you get so deep into that drug addiction. So I'm glad that you brought this up, and I think it's a great question that you brought up. And this actually is something that you can apply. This is an answer. I just think that this is something that would be useful for you. I was just thinking, this person-centered theory and idea is something that I think that you could maybe use with her. Because maybe she doesn't trust herself. She probably doesn't trust herself.
Yeah.
She doesn't trust herself to not relapse. She doesn't trust herself to be able to raise her son. You said she had a son, correct?
Yeah.
She doesn't trust herself to be all that she can be. But I think a lot of pumping hope and centering it on her. Because this is a time where she can sit with herself, explore her feelings, and understand that she has the skills. If she's willing to use them, she possesses the skills that she needs to be successful in recovery, to be successful as a mother, all different types of things.
Yeah.
So kind of like maybe go from an empowerment base.
Yeah, that's a really good idea.
It was just something that I thought of because I think that when in supervision, when we focus on you, it kind of allows us to be a counselor and kind of make sure, touch base with how you're feeling about it and where you want to go with it. And I think that this is something that could be helpful with her as well.
Yeah, that's a really good idea, and I think I'm going to try that in our next session.
Okay.
I think she would really take to that, because I've done a little bit of, like, just kind of validating where she's at and just really telling her she's doing a good job. She's asked me a lot if I think she's doing the right thing by being in the hospital and being away from her son.
Yeah.
And I've done a lot of validation and worked with her through that and why I think it's a good thing and stuff like that. So I think that would be a really good approach to do.
Yeah, and like I said, just what you said is like total instinct. Like you just did it like that, and that's why I'm saying just be sure to trust yourself and the skills that you do have, and not necessarily think about the skills that you don't have, because those can always be learned.
Yeah.
So what do you think was helpful from using this model today?
I think just really kind of just talking about it and being able to explore my own feelings towards why I'm feeling conflicted in the sessions and why I was kind of struggling with what to do.
Stuck.
Yeah, that was really helpful.
Okay, so do you think that this was helpful in, did I answer your question?
Yeah, and I think I have some more direction on kind of where to go now.
Yeah, and my focus was not necessarily to answer your question, but maybe get you thinking about your feelings of it, because I think self-awareness is very important in this, and being self-aware allows us to kind of like clear our heads, and then cognitively we know where to go from there.
Yeah.
So good. I'm glad that you were that I was helpful, and I would love to hear about the progress that you made with her. I mean, even asking her what would be helpful to you, center it on her, just like I do in supervision. So say, what do you think would be helpful for you? And then you could even narrow it down, like talking about family, talking about drug use, trauma, grief, any of those things. So that would be something that would be useful. So maybe go and take that to the next time that you meet with her, and hopefully that can help flow the session, and you can get that deeper meaning and feel like you're being helpful to her, even though I feel like you are right now.
Yeah, that's really helpful. Yeah.
Okay. All right. Thank you again for coming in, Ashley. I'm really happy that you came in and took your time out of your day, and I look forward to hearing from you next time.
Yeah, thank you.